I'm a registered dietitian.
I'm an exercise physiologist.
I'm a cardiologist.
I'm a clinical pharmacy coordinator.
I'm living with heart disease every day.
And I live with coronary artery disease.
Getting started with exercise after a cardiac event is sometimes very concerning for individuals. The important thing to remember, though, is that exercise is one of the greatest preventive tools that you can actually partake in. Individuals who become more fit actually reduce their risk of recurrence by actually up to 50%. Cardiac Rehab, it's a comprehensive program for individuals who have cardiac-related issues. The main intentions of it is to improve cardiac function, improve quality of health, and help individuals avoid reoccurrence. The program may involve a medical evaluation, stress tests, exercise prescription, nutrition counseling, psychological counseling for depression, stress management, anxiety. Cardiac rehab is typically divided into 3 phases. So the first phase would start initially when an individual is in the hospital. That would involve range of motion exercises and just simply starting walking. Phase 2 would start about 2 to 6 weeks after that, and that would last for about 3 to 6 months. And that would typically be, again, in a medical facility where an individual would be monitored very closely with an EKG hookup, as well as have blood pressure and other indicators monitored. After that, then they would graduate into a Phase 3 program, which would be more standard exercises like biking, walking, adding strength training exercises. An individual's physician and cardiac nurses would be the most helpful for finding local resources. Typically, you're going to find them in a medical facility. Additionally, some communities might actually offer these programs at a community center or at a YMCA. The key thing really is to start where you're at. Many people try to progress too quickly, and what we'd like to do is make sure that people get their physician's recommendations first to make sure that it is safe for them to begin and to help us determine what levels. The important thing is to include cardiovascular exercise, also eventually to build into doing strengthening exercises and flexibility exercises. What will really be important is when you do exercise to make sure that you do a proper warm-up and cool-down. Cardiovascular exercises would relate to biking, walking, anything that gets the heart rate up into a target heart rate range, which would be identified for you by your physician, and keep it up for a sustained period of time. Initially, when you begin, you may start exercising for 5 to 10 minutes. What we'd like to see is that people will gradually progress by adding 1 to 2 minutes of exercise each week. And ideally, we would like to have individuals exercise between 30 and 60 minutes. And they may initially start exercising 1 to 2 days per week. We'd like to build that up to 3 days and optimally 5 days per week. The interesting thing that we've found out with research is that an individual may accumulate their activity throughout the day. Some individuals don't have an extensive amount of time to exercise, or they may not enjoy the structured activities of a standard program. So what we would encourage people to do is to wear a step counter and see how much activity they are getting into a day. And you can simply increase that by parking farther away from the store. Instead of driving to the grocery store, possibly you can walk or bike. The important thing when you exercise is to pay attention to your body. If you notice any undue fatigue, any pain in the chest, the jaw, the back, the arm, notice any real extreme sweating, you'll want to make sure that you stop your activity and seek your physician's guidance. Important thing that I tell patients is to find activities that they will really enjoy. You're more likely to stick with it if you found something that you look forward to doing each time you exercise. It's very easy for people to get discouraged when they think that they're not seeing progress. You know, obviously we want to see major changes, and oftentimes when people can see even small improvements for their effort, it's very motivating. I want to encourage you to take time for yourself. Exercise is one of the best things that you can do for yourself, for your health, your quality of life. I'm Sue Masmer. I'm an exercise physiologist at Abbott Northwestern Hospital.